Today you have a panel who's going to talk about just three of those issues: housing, healthcare, and human trafficking, and the intersection with the livability and the social sustainability of our community.
Yeah, so good afternoon, everyone. Eric Golebiewski, aka Eric G. I'm a member of Anti-Human Trafficking Working Group, where I co-chair our efforts on behalf of the Nevada Resorts Association's Corporate Social Responsibility Coalition. And back in 2018, the Nevada Resorts Association CRS program established a number of goals, and one of them was ending human trafficking. And so we got together, all the major resorts, Caesars, MGM, Guinn, Boyd, Palms, Resorts World, and a few from Northern Nevada as well, with the Pepper Mill, Grand Sierra Resort. And we have monthly calls to talk about human trafficking, focusing on awareness and developing best practices such as a victim-centered approach to, one, identify trafficking that may be occurring in our communities, and how to save these victims and get them back to being independent and out of the trafficking cycle. And so I would say that in January, we've had a virtual statewide training seminar that involved the resorts, Department of Homeland Security, Las Vegas Metropolitan Police Department, and a number of our nonprofit partners, Signs of Hope, Rise, St. Jude's Ranch. And we all got together and we talked about best practices for identifying trafficking. When you do identify someone, how can you help to get them out of being trafficked? Where to send them for resources, how to get those resources to them quickly. And everybody in our state is internally focused on that. And I'm very proud that all the groups come together and really are focusing really hard on making sure that those victims have resources available, and continuing to sustain those resources, because we just can't afford to take a step back. I could tell you that I've had the opportunity to use the training to recover victims, and personally I could tell you it hurts to see when another person is treated like that, and that they're never going to be the same, and they're going to need mental health, they're going to need health services for the physical abuse, they're going to need places to go and shelter, they're going to need resources to help them get back on their feet, to get documents, IDs, and where to get their next meal from to get away from the trafficker. And so that's what we've been focused on currently over at the Nevada Resorts Association Anti-Trafficking Group.
Hi, all. My name is Nick Fritz. I'm the Impact Investing Director at Intermountain Healthcare. Many of you may not be familiar with Intermountain Healthcare. We're a large, now regional health system, nonprofit headquartered in Salt Lake City. And we're relatively new in the Nevada market. We've been here for 2 years or so. And Senator Brooks, I think, put this question to us and encouraged us to think about what does sustainability mean for us. And I think for us, sustainability is about health equity. So, I want to talk about our sort of community health needs assessment that we're finishing up right now as we speak this week. I think we'll have sort of final results, but I got a little peek behind the curtain this week, and it really interesting. I just want to read off a couple things. I'm not going to focus on the negative here, but if you know anything about nonprofit health systems, triannually we do a community health and needs assessment. So we look at sort of all available literature, as well as meet with community groups to just try to understand what are the highest needs for health and what are the barriers for people accessing health care care and achieving positive health outcomes. So here are the priorities that we're setting out for the next 3 years. Mental health, which is a priority, I think, across our region. Substance use and misuse, chronic disease, affordable and accessible care, and I think most interestingly for this conversation, the social determinants of health, specifically housing and transportation. This is the first time that social determinants have sort of made this list, and it's kind of a big deal because this sets sort of health system strategic priorities for the next 3 years. If you're not familiar with the term, this room probably is, but the social determinants of health are kind of broadly all of those factors that affect our day-to-day lives, right? It's where we live, where we work, where we play, our health behaviors. We know that collectively, all of these factors really create 60-70%, are responsible for 60-70% of health outcomes. Now, health care, high quality, affordable health care is sort of our main business, but if we're talking about creating health equity, that's only responsible for 10-15% of people's outcomes. So we're driving a lot of resources toward addressing these social determinants in all the communities we serve. A couple of kind of, thinking about momentum, a couple of things that we're doing across the system. One is, importantly, just screening for social determinants of health. So right now, rolling out across the system in emergent settings and in primary care settings, we are just simply screening patients to try to determine whether or not they may be lacking in some social determinant of health. So we're screening for, I'm going to read the list because if I don't read it, I'll forget one. Housing stability, interpersonal violence, education, transportation, food security, income and employment, family and social support, health behaviors, and utility needs. This screening is changing the way that we think about treating all of our patients. We're kind of in the middle of figuring out, okay, now we're screening, we're doing a pretty good job of referring to community partners in many instances, but how do we go a little bit further and maybe think further upstream even than that and address some of the community infrastructure that will support all those community resources. So, another thing that we're doing a lot of, I mentioned we're based in Salt Lake City, so much of this work has been done in Utah to date, but it's all sort of rolling down into Nevada now, is our impact investing work. So that's the area that I sort of work in. And we're doing a whole lot of housing investment. So investing in preservation, construction of affordable, oftentimes service-enriched housing, just to make sure that that community resource is there. I mean, we have a tremendous housing challenge in Utah, the same as we do in Nevada, it sounds like. And we're looking for more opportunities to address housing and other social determinant of health challenges in this market and others. So I'll stop there.
It's so nice to be here. I appreciate being up here. I'm expert, so I've been doing this 2 years. Many of you don't know me, and while Senator Brooks, I'm not fourth generation. My husband is fourth generation Nevada, Elko Carson. Love it here. I come from a western state, Wyoming. My professional background in economic development, really, when I was looking for some professional growth, the position with the Housing Coalition, which is also a young organization. One of our founding board members, Elena Muley from Charles Schwab Bank, is in the room. Emily Paulson with Anthem is in the room, also a board member. But I took a look at this position. I was like, affordable housing in Nevada, okay, what is that? And I looked at it and I said, well, affordable housing in Nevada is economic development. Not only can I do that, I want to do that. I want to help uplift affordable housing in Nevada. And it really is, as I came into the space, I also was asking a lot of questions. And then by the way, I started March 2nd. My first trip here to Las Vegas, I'm based physically in Reno, was canceled due to the pandemic. So I got to meet many of you, and so today I met Lauren for the first time in person. I've been meeting you in person for the first time still, but I met so many people over Zoom, and I work so much down here in the South. So the pandemic did allow me to connect in this state. But what I can tell you when I first entered the space is I realized there was really an opportunity for affordable housing. What I saw was a space and a conversation that was so focused on our crisis, which, make no mistake, We're actually worse than Utah. We do have the most severe shortage of affordable housing in the country, especially for our most vulnerable population. So I entered the space, but I realized it can't be just about the sky is falling, right? We have got to focus on solutions and strategic solutions to provide sustainability. So that just gives you some insights into how I've entered the space, and I'm really fortunate and excited to be part of the work with the coalition. So we're a 501c3 nonprofit statewide. I have incredible board members from the north and the south, public and private sectors, urban and rural representation. So really all of those voices, and for any other nonprofit directors in here, you know what that means, a lot of voices, inform the work and help guide me and our team as we move forward in the state for affordable housing. And we'll speak a little bit more potentially about our crisis and definitely about the intersections. But I just want to tell you the momentum for affordable housing, the difference now. I can't talk about the momentum without taking just 1 second to acknowledge those in crisis, because I'm so excited about housing and where we are going as a state. But today, as we all sit comfortably in this room, there are people who are losing their homes. And thankfully, I could not function on the front lines, so I don't serve the front lines. But I, like many of you, get those calls, and I really feel for our Nevadans. And so while the work and the things I'm going to talk to you about today are amazing, awesome, Nevada is leading the country in many of these conversations, they're not necessarily enough for today. And so we do also need to address that. But I'm going to speak about the momentum. $500 million for affordable housing from the American Rescue Plan Act funds. That is awesome. I heard some conversations that our recommendation was helpful. It had positive traction. But like you, I was listening to the governor's State of the State. Almost fell off my chair. I said, oh my gosh, $500 million, that's incredible. And it came on the heels, though, of a $300 million commitment of our tax-exempt bond authority, which is awesome. Last fall in October, Michael Brown, Director Brown from the Governor's Office of Economic Development, was on our panel at our conference, and he said affordable housing is economic development. And I was like, you better believe it. That tax-exempt bond authority that was committed, that's almost our full annual allotment of $300 million. Economic development also accesses. And they were at that table to be part of that decision. So that was an incredible commitment. Additionally, $20 million of the $75 million from our general fund that the treasurer referenced from the State Infrastructure Bank to leverage $200 million of investment from the AFL-CIO Housing Investment Trust. I don't know if you watched that presentation. If you're like me, you watched that presentation. I think it was in December. It was awesome. I looked around the country at this trust and where they are making investments around the country, and it's not in Nevada. So to bring those new dollars to Nevada and leverage $20 million with $200 million new dollars for affordable housing, that's amazing. Then I just want to recognize Clark County, $140 million. So right now, if you have an affordable housing project, by the way, you need to log on and submit your application because it's open until the 25th, but they have a community housing fund. And really appreciate that. City of Reno, Washoe, you know, the local jurisdictions are also doubling down with their commitment. And I'm talking about money, and it is hugely important and necessary. But of course, it's not everything. It's also the commitment, and the commitment of leadership by the Interim Finance Committee, Senator Brooks. The conversation at the April Interim Finance Committee, another meeting worth watching if you're like me, I was there in person, but was really incredible. You heard the deliberate and intentional conversation they had about and care for Nevada when they were committing those dollars, and they committed the first tranche of the $500 million, the $250 million for affordable housing. It was really, I was so grateful for their questions, for their conversations, and then I also want to recognize the partnerships it takes to make this happen. And the treasurer did point to it. We had over 70 stakeholders participate in a task force to develop that $500 million. Builders, right? developers, for-profit, nonprofit, advocates, tenant advocates, healthcare was at the table, local governments at the table. The voices were at the table. Economic development, Mike, who you'll hear from later, was at the table. People came together because we realize it's not on any one of us, it's on all of us to make things happen. So you'll hear, I'm pretty excited. There's a lot of positive momentum for housing, and we're not going backwards, by the way, right? As long as I'm here, so hopefully my board members will keep me here. As long as I'm here, we're not going backwards. I'm really excited to move the needle in affordable housing and help all of our Nevadans and help our businesses and business community move forward.
We sat down with some healthcare providers and we started discussing that we know that these victims, again, they get a lot of psychological trauma, they get a lot of physical abuse, and that goes through our healthcare system. And I don't know if our healthcare system was prepared for receiving some of these victims. And so you can see how it is evolving in the healthcare system now, where they're doing the screening and they're asking certain questions and they're identifying the red flags when somebody comes in for treatment to be able to connect that to human trafficking and the abuse that comes with human trafficking. And that way the doctors and the nurses and even the firefighters and the paramedics that are responding to these calls are able to identify this is what the problem is, and let me try to help you get to the resource you need to get to. We've also worked with different shelter providers so that when we have a victim, the process of rescue doesn't stop. They need somewhere to go to escape their trafficker. They need a safe place. And having that affordable housing in that location to be able to place people is an important factor of breaking the cycle of human trafficking. And that's kind of how I see it intersecting.
Part of the reason that these problems that we're talking about, human trafficking, homelessness, others, are so intractable is that they are so interwoven with one another, right? Economic development is housing, is healthcare, is the solution to human trafficking, is homelessness. I mean, these things are all so wrapped up. I think, one area where this that illustrates this really well for me is on the housing side, and it's around access to care. So this is a problem across populations, right? All the way from deeply low income Medicaid population, way under sort of qualification limits for Medicaid, all the way up to folks who are doing okay. I mean, part of the challenge with access is on, for a low-income population who is housing unstable and who has all of these other challenges, economic challenges, interpersonal violence challenges. There just isn't bandwidth to go to a primary care provider, right? Like every day is sort of just dealing with an emergent situation. So they access healthcare in that way as well, right? They present to emergency rooms way too late to solve problems, or they present for things that could have been so easily prevented, with kind of regular care. The other side of that is we're in a provider crisis right now. I mean, it's really hard to find healthcare for a large system. It's hard to find healthcare providers. Part of the problem is housing. I mean, all the way from our medical assistants to physicians, there just is not housing availability. And in certain communities, particularly rural communities and resort communities, boy, it is very, very difficult. So these problems kind of come together for us in this way where, not only is for the sort of folks who aren't experiencing health equity, the low-income population, not only do they not have the bandwidth to be accessing care in the way they should, even if they can come up with that bandwidth, there just aren't providers available. I don't know how to fix it.
I thought you were going to give us all the answers, Nick. Well, I certainly am not going to give us the answers. But I am going to just make us all, I think, a little harder about where we are and how we want to be as we come out of this pandemic. and as we leverage the momentum that I do think we have in housing. And one of the things I've learned about affordable housing, so first of all, I think the bandwidth. Sometimes it's hard for us to understand the bandwidth that some of our Nevadans are facing when they're housing insecure. And sometimes when I think about it and I'm talking to my friends who maybe don't understand it at all, they've never felt it, but how many here like to move, right? Anybody here? How many like me? I'm like, oh, thank God I'm still married and we moved, right? That's how stressful moving is. And in this affordable housing world, and particularly with those who are housing insecure, as we have increased rent prices, right? We've heard them, 20%, 30%, double, people trying to find housing. People are moving, right? You know, when Eric talks about the survivor victims finding some sort of shelter or transitional housing, then they have to move. You know, how are we going to upskill? I ask my economic development friends, this is your problem too, not problem, but this is your opportunity too, right? Nobody's upskilling if they're in a housing crisis, if they're not stable. So when I think of the intersection of housing with healthcare, when I think about the intersection with human trafficking, I think housing security is absolutely foundational. It is foundational for all of us and the success of our economies to grow, of our businesses to grow. And it's time now that we take care of it. I will say that on the human trafficking side, Eric, I understood quickly as we looked at the panel. I said, okay, I could see where affordable housing and our severe shortage really comes in. For survivors, particularly the first rung out of homelessness is called supportive housing, which I'm still learning about because it's different than affordable housing. It's part of affordable housing, but it provides wraparound services. Nick could be the expert sitting to my left here for sure on that, and that's where we'll intersect for definitely. Transitional housing. But I read a report. I went on, I looked up information about human trafficking and housing to understand better how we intersect, and I found a real startling statistic. So 64% of the survivors in human trafficking, of a survey that was done of survivors by this group, I can point everybody to the study, but 64% of them said that the way that when they were recruited into trafficking, they were either homeless or housing insecure. Right? So not only is affordable housing a solution and our lack of affordable housing for survivors an issue, but it's also part of the solution, part of prevention, right, for the human trafficking. The other component for housing is healthcare. We saw it in the pandemic more than anything, right? And so I've been very fortunate to partner with my health colleagues, and in Nevada, I think our healthcare is right alongside housing, and really grateful for that because you cannot have a healthy outcome when you're paying 50-60% of your income on your rent. You're probably not picking up that prescription, right, or visiting the doctor.
So how do you create ownership to move these interwoven topics about people together?
Yeah, it's a great question. As I was kind of thinking about this, I think there's the how and there's the who, right? So I think first about the who, and I think I've been really encouraged to hear the sort of cross-sector collaboration that's kind of in this room right now. I think part of solving these problems is coming at them a little bit differently. So identifying those institutions, whoever they are, right, cross-sector, who are anchor institutions in the community, I think is a really good place to start. I mean, these are if you're not familiar with the terminology, again, this room probably is, but anchor institutions are organizations that are rooted in place, right? They are here forever, and the health and well-being of the organization bends on the health and well-being of the communities they serve. Healthcare is a good example. Education is another. Really, I mean, in gaming, the resort community here, I think identifying those stakeholders who have a stake and talking about it a little bit differently. I mean, they may be political problems, but boy, they don't just, it doesn't fall to policymakers exclusively. I think we have found the social determinants of health, this framework I've been talking about, can be a little bit of a unifying principle to bring anchors to the table. I mean, it's hard to find somebody who disagrees that we ought to be trying to improve life expectancy. And you know, the magical thing about this framework is it's so broad. I mean, it encompasses just every facet of our lives. Everybody can see themselves in the social determinants of health, you know, as organizations who are coming to a table to try to fix something. I think that may be a good place to start.
I also was going to reference Jan. Yeah, from my partners, couldn't agree more. And we hear the collaboration, the coordination, and that is what it takes. And I think that's what we're seeing. What really struck me, and it's what I have realized, and especially when I have conversations with my policymaker friends. So last legislative session was my first session, right? Virtual, weird. And as I was advocating and still learning about the policies I'm advocating for, thankfully by about April, I had a pretty good idea, and I was like, ooh, that's why they're not that happy with me right now. Well, they'll come to my table, and they are. But what I realized was, oh my gosh, I sure hope nobody asks me what our goals are, because I don't know what they are, right? And I asked, I'm like, is there a report I'm not reading? Did I miss this one? Like, I've been reading so many things since I started and COVID. What is our plan for housing? Does anyone in this room know what our plan is for housing? What is our target? And how can I, as an advocate, and how can policymakers say, so first of all, I do want to say, Senator Brooks, I'm not suggesting that the $500 million was not good. It is very good. Because I'll tell you what we were having, right? So I'm also data-driven. From 2014 to 2020, and I'm going to talk about subsidized housing, housing that it has some federal subsidies in it that supports those to help so that they're not paying ideally more than 30% of their income. Housing's complex. We can have a conversation this evening. In 2014, we had 36,000 units. In 2020, we had 36,000 units. Like, is anyone not seeing what I'm seeing here? So when we say, will the $500 million help? Will the $300 million commitment of our bonding authority? You better believe it's going to help, because we need that catalyst to move the needle. But in the meantime, I would ask us, what is our plan? And I have my private sector friends that I got to meet last session, and they're members now of the coalition. I have my private sector friends saying, yeah, but we just need more housing and that'll help, right? That'll help stabilize the market. Well, first of all, no. Affordable housing doesn't just happen. Below 50%, it does not get built by the market. So we do need the support of the federal government and the programs run by the state and our local governments. However, what I can't tell you is what we can do and how much opportunity there is even above that, right? From 0 to 120% of area median income. So if you think of area median income as $60,000 a year, these are working Nevadans. We have a housing shortage. And that does impact the availability at our lowest rents, right, for our lowest income Nevadans, because we have people taking up that housing that maybe if there were more options, there could be housing. But I could tell you we don't have a plan. And so for policymakers, you're doing the right thing. At this point, we have such a great need. We just need investments. We need resources and programs. But in order to move forward and make a difference, we need to be strategic and intentional. But in order to do that, we need to know our need. And so that's my challenge to all of us, actually, is to ask ourselves, what is that need?
As we close out, and keep your eye on Lauren, because she will be waving a handkerchief as you hit the top of the hour in your answers. I want you to, maybe we'll start with you, Christine, and you can build on your challenge to this group. That's what I'd like you to end with. What can we do in this room to maintain the momentum for sustainability and resiliency in your space? What do you need us to do when we leave today?
Oh yeah, this is my favorite part, because I hear all the time, oh, but that's those are one-time funds. What about when the money runs out? I love that question, because guess what? It's not on the treasurer, it's not on the governor, it's not on the housing division, it's not on the legislature, it's not on Intermountain Healthcare, it's not on the resorts. It's actually on all of us to choose and recognize our role that we play in moving the needle for housing. And the business voice, by the way, I could use more of those voices. Your workers, our neighbors, our community members are the ones who are housing insecure right now. So I would love more of your voices at the table, because we're a table that has bias for action, right? And I think that's also important. So it's engaging, it's having bias for action, and it's setting a full table, not just with one voice, but with all the voices so that we can work together towards the solutions.
Thank you. Gentlemen?
Yeah, we think about, I was talking about who and who anchor institutions are, and I think we have a tendency as kind of large companies whose business is not directly in these spaces to have these bolt-on programs that are very good and doing good work, but they're not solving the systemic issue, right? I think part of the challenge of being an anchor organization in a community is realizing that it's more than just the sort of bolt-on programs that you do to support the community. It's about a way of doing business. So, it means thinking about who you're hiring and whether they're representative of the communities you serve, how much you're paying them, where you're buying stuff from. Does it come from here? Does it come from somewhere else? And how much energy, water you're consuming, how many harmful chemicals are in your supply chain. As a healthcare system, we've been really focused on the sustainability thing for a couple of years, and our sustainability guy talks to the group, all the supply chain leaders. I had no idea how many deeply toxic chemicals were in the couches that we bought. These aren't, not decisions not ways that we have traditionally made decisions, but I think that's the challenge. Think hard about the way you conduct business and how it affects the systemic issues that are driving these inequities that we're talking about.
Yeah, I'd have two comments on that. One is, first and foremost, always take a position of non-victim blaming. A lot of the victims in human trafficking, people say, oh, she can change that or he can change that anytime they want. They really can't. And so not blaming the victim is one thing you could take away and spread that culture throughout, your influence and in your organizations. And number two, when you're in your organizations, look and see what are you doing for the 3 H's? What are you doing for, affordable housing? What are you doing for healthcare? And what are you doing to combat human trafficking? And what is your organization and entity doing? And how can you partner and find out more about what you can do in that particular space?